Is this mic on? Can you all hear me back there? Okay, we got a lot to do. So buckle up. Okay, now how do I use this? I've had 14 years of college and what? Okay, so you all obviously know who I am, and I thank you very much for having me here, and it's been a pleasure working with everybody. So just a little bit about my background. I attended the University of San Diego and got a Bachelor's of Science in Human Biology. Attended UCLA School of Medicine and in practice for 33 years in primary care. Started off as an ER physician and worked in trauma centers for a long time. But I think, as you know, my whole issue is about transparency. So I've tried to be transparent, and the graciousness of our hosts with Rex and Patricia, I really appreciate it. But I do want to let you know that I have not been retained by any attorney firm. I am as neutral as one could get, except for when I find out what I find, it does upset me too, like you. I mean, we're all patients. Even the gas company will be patients one day. So saying that, I want to be transparent in regards to an issue which I have to admit I'm a little upset with. You know, all of you know that I was released from my position, okay? But somebody seems to have been circulating a Facebook photo around, and I just want to be on the record, okay? The first one to tell you that this is not me. Now, just for the record, since we have a lot of attorneys here, you can see the urgent care in the background. And this was post my relieving of my position. But if you look at the shred-it truck in the background, I can tell you when we took that picture, I just discovered that this morning. So it wasn't a hoax. All right, so let's get into it. So everybody knows these stats, but I think they're pretty important to review. So 100,000 plus metric tons of methane gas. By volume, this amount is 220 times greater than the oil released during the 2010 Deepwater Horizon oil spill in the Gulf of Mexico. That's a lot. It was 16 weeks or 4 months of a continuous dumping of chemicals into your homes. It was unprecedented of quantity, combination, and duration. It was dumping numerous toxins into your sanctuary, your homes, creating a nuisance and trespassing, the ultimate trespass, when the toxins affect you, your family, and your pet's health. So what we're going to do is we're going to go over this, and we're going to kind of move and then slow down at times because there's very important points here. So this is the layout. We're going to go through the scientific foundation. We'll start there. 3 ways this can enter your body, okay? We have inhalation, absorption through the skin, and ingestion. And ingestion is done by 2 ways. We always think of ingestion as either eating food, but it's also drinking the water, which we'll get to. After the toxins enter the body, approximately 50% are converted into carcinogens by your own liver, okay? Those same enzyme systems that sit in the liver also sit in your red blood cells, and they do the same. It's stored in fat. Some of the chemicals are fat soluble and stored in fat, and you have what they know as bioaccumulation. So you can accumulate this. It goes out of the serum and then dumps back into the blood later and goes back to the liver and creates more poison. Smoking and alcohol increases the risk of the side effects. How does it damage you? You have direct damage to the cell. In a single cell, you have a plasma membrane. It can damage the membrane, cause lysis, and kill cells. We know it's metabolized into carcinogens, and the carcinogens take a form of free radical. A free radical is a chemical, a charged chemical that wants to bond to something. So what does it bond to? It goes into your DNA, and it bonds to your DNA. When it does, it creates a mutation in the DNA, a breaking of the DNA, and that can have all kinds of clinical effects on you. And when that effect hits an area of a chromosome that has to do with cell replication, we call it a carcinogen. It causes cancer. So it starts replicating out of control, and hence you have an example of that is multiple myeloma, aplastic anemia, leukemia, as benzene goes from, on the left, benzene to benzene oxide in the liver, DNA mutation, and then forms a carcinogen. We've known this. This is the father of toxicology. It goes back to the late 1400s, okay? Poison is in everything, and nothing is without poison. The dosage makes it either a poison or a remedy. So we've known this since the 15th century. Today, the Agency for Toxic Substances and Disease Registry, the effects of exposure to any hazardous substance depends on the dose, the duration, how you were exposed, your personal traits and habits, and whether other chemicals are present. So what has happened to you? Did you just get, the doctor that did that, fantastic, but they talked about one chemical. You have had a plethora of chemicals. And I've always stated this, is you don't know. There is no literature. So when you talk about the EPA or you talk about OSHA or you talk about all these regulatory agencies, they don't know what this does all at one time. You are in uncharted waters. That's where it is. So I initiated a study for reasons we'll get into. Is phase 1, started in January of 2016. It was performed by an MD, myself. Why? Because in the clinic, the number of patients that were being seen increased. The presentation was very unusual, hitting numerous organ systems. And I sat there, and I remember the day sitting there going, oh my gosh, so what is being done about this with all of our public agencies? Nothing. Until I finally received a letter as a provider, January 22nd, 2016. And basically it stated this: there are no recommendation where a recommended toxicology test of blood, urine, or other tissues for the clinical evaluation of patients exposed to the gas leak. While laboratory tests do exist for monitoring compounds, such as benzene in petroleum, industry workers, these tests are used only for the purpose of biomonitoring and not for clinical evaluation. I disagree. So the stats of the first study, just to go back, I studied 52 patients, 31 females, 21 males, age distribution 11 to 80, age concentration between 40 and 60. Here are the symptoms. 79% had a cough, 77 headache, nosebleed, dizziness, nausea, vomiting, diarrhea, eye irritation, and a rash. Keep those marked, not that you need to, you probably have all felt them. Other symptoms, people complained of tingling of the hands and the mouth, feeling unfocused, forgetfulness, dry mouth, laryngitis or change of voice, upper airway congestion, joint and body pain. Phase 2 started in January 2017. 72 patients, 51 females, 21 males. 13 to 91 was the age distribution. Still, headache, fatigue, cough, nausea, vomiting, diarrhea, and nosebleeds. Now, keep in mind that this was January 2017. Okay? These were not new symptoms that started in January 2017. This is a continuation. So 1 year later, the health issues are still there. Other symptoms in phase 2 was rash, laryngitis, sore throat, sinus symptoms, memory loss, depression, hair loss, body pain, palpitations, this would be vertigo, and insomnia. So we went to the toxicology phase, started in April of 2017, and it was because you asked me to do this, okay, and people continued to come in and say, can we test, can we test, can we test, and it was like, okay, we'll test. Started off with doing a urine test for VOCs. VOCs are volatile organic compounds. Okay, what is a volatile organic compound? It's a chemical that wants to be volatile. Okay, it wants to be a gas. It wants to go off into the atmosphere. There's numerous. We tested for 20 of them. We also tested and started hair sampling for 2 things, elements and metals. 38 in total. Who studied this? Well, I can't tell you how my ears were full with that, how people didn't trust anybody in the local. So I said, okay, we need to go out of state. I talked to a lot of labs, interviewed a lot of labs. Ended up going to the Great Plains Labs. It's in Kansas City, Kansas. And I did fly back and interview with them and looked at their operation. Great Plains did the urinalysis, but processed the hair sampling, which we'll get into, and it went to Illinois to be tested by doctors' data. Who are they? William Shaw, PhD. Biggest point I wanted to make is he's worked for the Center for Disease Control. Dr. Matthew Pratt, he's got his PhD in cellular and molecular biology from the University of Michigan. He's trained under these doctors. The one doctor I spoke with, which was Curtis Clausen, he is renowned on toxicology. They gave a testimony after they've evaluated everything for us. And the testimony is the anomalies of certain chemicals found in the samples were significant. This is you. The group was uniquely different than other similar testings we have done. Therefore, we strongly suggest further investigation into these findings. So, the toxins in the urine basically are preceded by ingesting or inhaling the toxin. It's metabolized by the liver, it's dumped into the bloodstream, cleared by the kidneys, and dumped into the urine, of which you give the urine sample, we ship it back, and they do the assay. And here's how it worked. So the patients we tested were 106, 70 females and 36 males, age distribution 3 to 79. The one chemical, as the 20 we tested for, we had to compare you, the people in the North Valley, to see if you were unique as compared to other Southern California, other states, and United States. They have to run what they call a significant or a p-value, which is a statistical significance. The one thing that stood out on everybody was this chemical. Okay, PGO, we'll just call it PGO. This is the metabolite that when you ingest either styrene or ethyl benzene or inhale it, okay, the liver turns it into PGO and it goes to the urine when it is measured. This is significant. Now, you don't know what a p-value is. We're going to talk about it in a second. But if you look at the graph, you can see Porter Ranch as compared to California. The p-value, we'll note it here, is 0.0005. Anything less than 0.05 demonstrates a significant statistical difference. You are different. What is it? Styrene is a derivative of benzene. The health impact, it's a known carcinogen, especially in the cases of eye contact, also in the cases of skin contact, ingestion, and inhalation. Chronic exposure leads to, sound familiar here? Tiredness, lethargy, memory defects, headaches, and vertigo. You've seen this slide already, so I won't go too deeply into it. It just shows that they have a history of releasing this, okay, as compared. So, everybody asked me, what about the benzene? Did I ever expect at 14 months post the killing of the whale that anybody would have benzene in their urine? No. We tried to do everything and pull it out by putting people on glutathione and see if we could pull it out of the fat and measure it. We did 2 different arms of that. We discovered no benzene. Now, there were a few patients that came in to me and showed me their labs, which I have and can testify to, is that they had positive blood tests for benzene closer to the time of the blowout in January. Then we went to hair sampling. This is how the hair sampling works. It takes approximately 2 to 3 months after ingestion, inhalation, or absorption for toxins to show up in the hair. So as you can see this photo, I think I can, does that come up on the screen? Oh yeah. Yep. The blood flow. The blood flow feeds the follicle. So if the chemical is into your blood, either by ingestion or inhalation, it then contaminates the follicle, and the cells in the follicle then lay it down in the protein of the hair, and it grows out. But again, it takes time for it to become positive. The hair shaft grows at about a ½ inch a month, so keep that in mind as we forward on here. Different patients can obviously have different, because not everybody's metabolism is right on. If you have hypothyroidism or something like that, you're going to have a slower growth. So what did we find for the metals? 103 patients were studied, 62 females, 41 males, 3 to 80. Good distribution. And this is what we found in your hair. It's going to get better, so buckle up. So we studied a lot of chemicals in the hair. And what we tried to do is go through and look at the ones that were different from the other areas. Again, is Porter Ranch unique? And these two on the top of uranium and lithium are unique. How unique? 0.009. Remember, anything less than 0.05 is statistically significant. And as you can see, in regards to uranium, Porter Ranch in red versus California versus the United States versus Florida, Missouri, and Tennessee. Now, let's talk about uranium. Uranium is a rock. It's 238. 99% of it is in a rock form. It won't hurt you. If you put it on the outside of the body, it will not. It gives off alpha radiation, but it does not penetrate or hurt you. But if you ingest it either through inhalation or drinking or eating it, of which, remember, when water contaminates soil, what grows in the soil? Food, vegetables. You eat the roots, so forth and so on, and you can get it into your body that way. When you expose it internally, the alpha radiation does damage tissue. Now, keep in mind that uranium has a half-life in the millions of years. So if you started out today, it'll be a long time since you get the final product, which is what? Lead. In between in there, you get radon. How long does radon last in its natural decay process? About 5 to 7 days, depending on who you read. So it's very short-lived, and it gets on and goes to the next. Uranium also gets metabolized, and it turns into what they call a uranyl ion. That ion goes to bone because it loves phosphate. And when it binds to bone, it replaces your bone, your calcium. It can accumulate in bone, liver, kidneys, and reproductive tissues. Normal functioning of the kidney, brain, liver, heart, and other systems can be affected. Renal toxicity is a major adverse effect of uranium. Cancer risks are associated with the radon increasing lung cancer in non-smoker by 5-fold. Now, this is not an intermission, but I always have trouble pronouncing this, so it's the bib label lithinated lemon lime soda. Say that fast, please. 7-Up. Where do you think you get the up of 7-Up? From lithium. When was it brought to? This I thought was very interesting. Oh, I have to tell you this just really quick, but we'll go over it in a minute. But this was brought and put on the market 2 weeks in 1929 of October 29th, 2 weeks before the stock market crashed, as a mood elevator. Just saying. So how significant were you for lithium in your hair samples as compared to everybody? 0.0004.
Horrible.
Now you can see the graph. So we talked about that. They actually marketed this when it first came on the market for a cure for a hangover. But interesting, which I want you to note this point, they removed it from 7-Up in 1948. There was probably a reason, right? So we'll figure that one out in a minute. So the health impacts of the lithium molecule. And it's not a molecule, it's actually just an atom. Causes nausea, diarrhea, dizziness, muscle fatigue, dazed feeling, fine tremor, frequent urination and thirst, weight gain and swelling. Sound familiar? Levels of toxins vary. Why? How do the levels of toxins vary in you? Why is somebody's profile different than somebody else's profile? I'm asked this all the time. So I said, okay, boy, really got to dive into this. Time spent in the community. There's a lot of people that spend 24/7 in the community. Your children spend 24/7. If they go to school locally, they come home. They go back to school, they come home. So they spend a lot of time in the community. The distribution of gases, which we should talk about later, and the wind that carries the gases through your canyons and into your homes. They talked earlier about how your home is aligned on a north-south vector. Also, do you have any pre-existing issues? From hypothyroid, migraine headaches, heart disease, hypertension. Your genetic makeup, I need to talk about this for a second. On your gene, or all of your chromosomes, you have a little tail end called a telomere. And in the telomere, they think is where you make in your liver your own glutathione. Your glutathione, we're going to find out in a minute, is a good chemical which takes these free radicals and pushes them back and doesn't allow them to become free radicals, which then bond to your DNA and affect your cells and hurt your body, in essence. The telomere is where they think is the genetic difference and why someone has a longer telomere than a shorter, that the glutathione is not being synthesized as well, and these levels will be higher. It's speculation, but the attorneys call it speculation, I call it theory. This is important. The toxin results also varies in homes for resistant factor. Your sanctuary, or home, is the age of the home, the ceiling around the windows and the doors, either wood or aluminum. Your roofing, your north to south orientation, attached garage, time in garage, door open, entrance from a garage, and time percentage running your HVAC. So how long has this been going on? It's a song. I was sitting at home and I went, you know what? It's kind of bizarre, but you know, it's like the hair. We got to get something with the hair to see if we can date it back. It's like a ring of a tree. So I called up the lab and I said, hey, have you guys ever done that? And they said, well, a little bit, but we're not really sure. Why don't you try it? So we said, okay. So we set up a program and we had everybody cut their hair, and we had so many people. And they cut it at the base of the scalp, and they cut it, if it was 15 inches, they would cut it at 12, and they would take an inch here and an inch here and put it in 2 separate envelopes and send it to the lab. Let them do the assay. Now, the proximal end of the hair, closest to the scalp, okay, is the most recent. The distal is what was happening, and if we apply the ½ inch a month, we've got 12 inches, or 2 years. 2 years, and you add on the 2 to 3 months that it took to get in the hair, takes you back roughly to July 2015. Patient 1. The left is the proximal, the right is the distal. And as you can see here, this was 2 years ago. This is today, a little bit of healing. Patient 2. 2 years ago, here, difference. 3. 2 years ago, ooh, uranium's still way up there. Why? 1,000,000 years. Here, next, patient 4. 2 years ago, today. I shouldn't say today, I should say at the time they cut it, to be accurate. Now, I knew everybody would come up and say, well, Nordella, come on, you're a quack, and you might be right, but the issue is what about, they've had 2 years, okay, women. They've abused their hair, they've shampooed it, they put chemicals in, strippers in, this, and I've learned all of this, by the way. Color your hair, put the aluminum foil out, roll it up, try to get a new radio station under the hairdryer. Everything in the world they've done to their hair. So I said, okay, you're probably right, but let's look at it. So this is patient 5. Look here. Look here. Present. This. Now, what does the second 5 stand for? It's a 5-year-old. Not too many days in the beauty parlor. If there is, I'm going to talk to the parents. Patient 6. This is a 3-year-old. Okay, now this baby was accumulating toxins at about 9 months would be my best guess. I don't like that. This patient threw me off. I was like, what? I couldn't figure this out. Now, when these came back in, I did not look. I kind of did a single blind study, as they would say in science. But I looked at this, and this is a proximal on a patient. So I looked here. That's today. And I look over here and go, holy moly. What is that? Well, this is 12 inches here. And this is present day. And then I went, what? Got this sample back. I said, wait a minute, something's really screwy here. So I looked at this sample and I go, holy moly. This was 14 inches and this was 12 inches. So this was even older on the hair sample. Oh, and by the way, it was a male. And they could have gone to beauty parlors. I don't know. I don't want to be judgmental. So what can you do to treat some of this stuff? Sauna baths have been shown to, the skin is an organ of secretion. You sweat, it comes out of you. Okay? How does it get in your hair? It circulates up to the hair follicle. You saw that. It comes out of your body, but it tags your hair, and then we measure it. We know sweating helps. Glutathione we talked about. Now, glutathione I would not recommend necessarily that you ingest it orally because only about 10% is absorbed into the bloodstream. The gastric acids and enzymes destroy it before you can really get it in. So we go to another chemical, and the chemical is cysteine. Cysteine is the rate-limiting amino acid that you should take in that will allow the precursor molecule for you to synthesize the glutathione and move forward. Here's a few food substances it's in. Now, we're going to talk about what's been done for you. Okay? So we're going to do a little history and we're going to do a little story. And I want to start it off with UCLA. So we all know the dates from October to mid-February, what happened. UCLA was on the scene fairly early and produced a letter March 19th, 2016 to inform the residents. And states, during the blowout, UCLA was on the scene. Air testing was done January 13th, 2016 to February 15th, 2016. They measured 25 volatile organic compounds in the air from 20 locations. In their letter, many of the VOCs have known toxic effects. It's documented. Same letter noted particulate matter in the air from 6 locations. Particulate matter can be inhaled deeply into the lungs and may adversely affect many human health endpoints. Results for VOCs and hydrogen sulfide was negative. Same letter, these elements can find their way into homes. Dust samples were taken in 7 unoccupied, non-smoking homes in Porter Ranch. March 10th, 2016. Documented, preliminary results detected benzene and hexene in the dust in 2 of the homes tested. Keep that in mind, in dust. So what did they do? They went in and they wiped your countertops, they wiped your coffee tables, they wiped anything that had a smooth surface. They didn't want anything that was porous, like concrete or like an organic wood that you had as a coffee table, because it sat down in the cracks. So they wanted it smooth, and they took and they did an assay. And they did the assay on only 7 homes because they were limited for funds. Based on the UCLA researchers' findings, they were compelled to advise the LA County Department of Public Health, and I'll refer to them as Public Health from now on because I don't want to continue to read this, US EPA and Southern California Gas. The UCLA team also advised on the protocol for the future indoor testing detected at Public Health. These findings suggest the need for additional indoor testing. This was 2 out of 7. This is where it started. Now, in that rough time frame, to go back a little bit, the county, Public Health, a couple of points, received 700 health-related complaints from October 28, 2015 to February 18, 2016. 16 weeks, average 44 calls per week. They also received 150 health-related complaints from February 19th to March 3rd, 2016, 75 calls per week. I highlighted March 3rd because it goes to this, which is a letter received on March 8th. Okay, 5 days later. And then goes to this. Now, I want to read. When evaluating patients presenting with mild headache, gastroenteritis, this came to us. I'm a medical doctor, came to me to tell me what I should be looking for, so forth and so on. So let's go back. When evaluating patients presenting with mild headaches, gastrointestinal or respiratory symptoms, or those with other non-specific complaints, emphasis added. I'll put that in. Look for alternative etiologies. Etiologies means that what causes it, causation. Look for alternative etiologies other than air contamination. Avoid performing any toxicology tests. These are not recommended and unlikely to prove useful in clinical evaluation of the patient. I'm going to move on. The county, 2 days later, March 10th, 11th, and 12th, decided to implement the CASPER study. Community Assessment for Public Health Emergency Response. March 10th, 11th, and 12th. Did a door-to-door survey for 210 houses, 3 miles radius of well SS-25. Conducted 3 weeks after SS-25 was repaired. Now, I'm an emergency room physician, and I guess I have a different definition of emergency, but the time frame of this, the well blew in when? How many months?
6.
This is what they found. Thought was interesting. So we put it in a graph format. Any symptoms, maybe like a non-specific symptom? We talked about that. All the E and T, all the way down. Do these symptoms look familiar to you? Maybe something that you felt and something I also found in the study. So we're pretty much on path. I found this to be very interesting. This was comments from the field people who did the interviews that came in, knocked on your door, said, "Hi, Mrs. Smith, can we come in?" Several interviewed staff reported experiencing health symptoms, including throat irritation and wheezing, among interviewers at households closest to the well and exacerbation of asthma symptoms. Headaches, irritation-type symptoms were also reported amongst conducting the interviews. These symptoms improved shortly after the field teams left the sampled homes. Too bad you couldn't. 2 points I found interesting in the Casper study. One, 61% of the medical care were mainly from doctors, family doctors, and urgent care centers. Well, what did I have right in the center of the community? 3 miles dead south of the blowout was a family practice urgent care center. So logic would have it, we probably saw quite a few, and we did. 40% of households noticed an oily residue on their personal belongings. 40%. So, public health goes ahead and initiates a study on the basis of UCLA's recommendations, okay, and these findings, to go in and look at the community. And they did. They studied 103 unoccupied. What do you do when you unoccupy your home? You close your windows, you close your doors, you turn off your air, you don't have a car in your driveway or a car in your garage, correct? It's a box. It's an incubating box. They're non-smoking homes. We have no reason to have benzene in them. We have no cars and we have no cigarette smokes because we're non-smokers. They also studied 11 homes 6 miles on a dead southeast vector in a clump, which we'll show you in a minute. Now, to my knowledge, and I might be absolutely incorrect here, and I apologize in advance, but these homes that the 11, we could not find the people, and I don't know if they were occupied or unoccupied. If they're occupied, then, somebody wants to say something, we'll catch it in a minute. Then they're really not a comparison, right? Would make just scientific sense. It's apples and oranges. So, public health knows of UCLA's March 10th findings. 28.6%, 2 of the 7 positives for benzene and hexane. All of these agencies weigh in. I'm going to let you look at that while I take a sip. Very professional, very smart people, right? And they signed it over to a company called Layton, and they did a study. They did all of the mechanisms of the study, and they published this on May 13th, 2016. So overall, they did 114 homes. They tested numerous chemicals, 4,700 pages. And don't ask me if I read them all. What did it cost? I don't know. Here's the map. So these are the areas that got tested, and you look right down here. That's your control group. Now, I'm going to take a minute on this. So let's look at this closely. So you have air in blue, and you have wipes in orange. So they tested for 4 major groups. There was a couple of other, but the 4 major groups I focused on were sulfa compounds. SVOCs would stand for semi-volatile organic compounds. They tested 20 in the air in canisters. So basically they went into a home and they set up canisters, and they took measurements and they took them out, and they did all these measurements on 103 homes, and then they wiped down their counters, wiped down all over the house, and they did, so you get the picture. They tested 0 wipes for sulfa compounds, 67 out of 67 for SVOCs. They went into metals, and I looked at the metals, and I go, okay, so you tested 30 metals in the air, and you tested 16 metals on the countertop. Didn't make any sense to me. Metals are heavier, I would think would precipitate out. More so sit on it. If I was going to do anything, I'd reverse it, or why not just do apples to apples and do 30 and 30? Don't know. Now, one thing I will tell you is lithium was not discovered in the air, okay, and they didn't look for lithium or uranium on the countertops. Excluded. Then you move over to the VOCs, benzene, of which literature was produced all about benzene. Causes cancer. They tested in the air 75 VOCs, including benzene. They tested no wipes for benzene. Why? Knowing that UCLA had found 2 out of 7 that had wipes. So, no VOC tested in wipes. Benzene, molecule of concern, known carcinogen. Why? Because it's volatile, was the reasoning we received down the line. Despite the fact that, we're going to go over in a minute, that what was found in the canisters? Benzene. Don't test the wipes. We found it in the canisters. We'll go through that. Is benzene safe? Well, this is really interesting. So now you get to all of the state levels and EPA and OSHA and all of these people that are supposed to know everything for us that's the best for us. And you have the World Health Organization come along and say, hey guys, we're the world. Zero. You should have really no exposure to benzene whatsoever. If you choose to smoke, you choose to smoke. That's your benzene exposure. That's your choice. It's a free country. But to have somebody else come in and put it in your home potentially is trespassing. So the EPA, better known as the Office of Environmental Health Hazard and Assessment, down below on the left, came out and says, okay, here's our benzene levels. We've got a chronic exposure, an 8-hour exposure, and an acute exposure. The chronic exposure is somebody who is exposed for a lifetime. And that's what they chose to use. It's like, well, wait. These people aren't exposed for a lifetime. They're exposed for 16 weeks. Excuse me. The 8-hour exposure would probably be more like it. But again, people are in their homes usually more than 8 hours a day. Right? We're usually at work 8 hours a day and then home the rest. And the acute level is for 1 hour. Now, how did they do these studies? They take mice, guinea pig, whatever, and they'll pull their blood, they'll put them in a dish, and they'll expose them to this chemical, and they'll watch the way the white cells replicate. If they don't replicate properly, they say, oh, that's a danger level. It really, in my opinion, is not an exact science. Most importantly, no agency, the only thing I could find was in regards to one piece of paper that said that they protect, the levels are built in to protect for children. Now, when I was a resident going through UCLA hospital and clinics, when we rotated to pediatrics, we had the Harriet Lane book. It was the Bible of pediatrics. We would open that up and write amoxicillin for a child. And it's like, how much do you weigh? How much do you weigh? How much do you weigh? Prescription, we'd write it out. And it was all based on weight. There's been nothing I've seen in any of this literature that I've reviewed for the last year and a half that based anything on kilogram of body weight. Does this impact your children? You bet. You don't get the same dose. I don't give somebody 1,000 milligrams that's a Tylenol dose for an adult and give the same to an infant. Right? We dose it. So, testing in late March to early April was the tests that were done in the canisters of the homes. Benzene was found in at greater than 3 levels, which you just saw the levels, in 6 of 103 homes, or 5.8%. One of the homes in the control group had a benzene level of 5.8, greater than 3. And remember about benzene, what it causes. So here is a screenshot of the report. As you can see, this is a control, 5.8. That's a home. And we know it above 3. And then we go to this one. One home had a level of 29. It's a resident, 10 times greater than the 3, or made the 1 hour exposure. So the question is how long had that been going on? So we ask the questions again. 16 metals, wipes, no testing for uranium or lithium. 30, no metals were detected, including uranium or lithium. Why the 16 versus 30? I have no idea. Then on May 31st, I received this. Now we just said that they didn't test for wipes on the countertops and didn't measure benzene, correct? Correct. And they found benzene in the canisters out of 6 and 7, including the control. So we go, as described in the summary report, the majority of the priority chemicals including benzene, polycyclic aromatic hydrocarbons, commonly known as the black soot, and sulfur compounds were not found to be elevated in the air or the dust in the Porter Ranch homes. I apologize, but I don't find that to be a truthful statement. Other chemicals of my concern for you were acrolein and dichloromethane. So real quick, here's the acrolein levels set by same agency. C is the chronic, 8-hour exposure, and acute. They use 0.35 as the hallmark. Anything greater than 0.35 was elevated, according to Cal EPA. So I went back in and looked at all of this. And yes, I don't have a social life. That's why I do all this. 96% of 103 tested homes were positive for acrolein with levels greater than 0.35. 100% of the controls were positive for acrolein. 83% of the schools tested, 5 of 6, had acrolein levels greater than 0.35. We heard about acrolein earlier. Where does it come from? Not propane. It's not a typo, it's propene. It's a byproduct of oil refining and natural gas processing. This is the chemical for it. It gets into the air, it oxidizes with the oxygen in our environment, and it creates acrolein and it goes into your homes. It's also released from smoking, but guess what? These were non-smoking homes. We've seen this slide as well. As you can see, the significance of the production as compared to a refinery. What does it cause? It's toxic, it's strong irritant. We went over this for skin, eyes, and nasal passages. It also causes an increased risk in lung cancer. And it causes a very unusual syndrome called hemorrhagic cystitis. And that's when all of a sudden, one day, you just urinate blood. Now, to address the acrolein level, I want you to be really diligent on reading this with me. This was a report, a sample report, as you can see, to somebody's home. And it talked about all of the chemicals they tested. They said all 44 chemicals that were tested within the range observed in comparison homes. Well, first of all, I'm sorry, but the comparison homes shouldn't be controlled, and that statement, in my opinion, should not be there. All 44 chemicals that were detected were below the California Environmental Protection Agency EPA reference level except for 2 chemicals, acrolein and benzene. Okay? This is a patient that had their home tested twice. Why? Because their benzene level was 4. So they were so concerned at the 4, they came out and tested their house again. But what happened is I picked up on this, their acrolein level was initially 2.2 and went up to 4.7. Now, if you go to the yellow column and look at that, you look at those numbers for acrolein, it's 1.9 to 7.8. Those are the controls. How can they be controls if they're abnormal above the 0.35? And as you can see, the 0.35 is on the right, and it says California EPA reference. Then I came across this to try to explain this, and I'll just pick up on the sentence where it says acrolein. Acrolein was detected at 4.7, and recent study of non-smoking residential homes in California reported indoor concentrations of acrolein ranged from 2.1 to 12.2. Cites the article. I read the article. Has nothing to do to apply with your clinical scenario. Justifying the level. I don't know. I don't know the intent. So now we go over to dichloromethane. Just a couple of facts. It's from an industrial emissions. Path to internalization is inhalation absorption through the skin. Unique. Can turn into carbon monoxide and cause carbon monoxide poisoning. Symptoms: difficulty concentrating, dizziness, fatigue, nausea, headache, numbness, weakness, Irritation of the upper respiratory tract and eyes. Sound familiar? It may be carcinogenic, it's not clear yet, but it has been linked, they think, in animals to lung, liver, and pancreas. Importantly, though, it has been associated with salivary gland cancer. And people with pre-existing heart problems exposed to this, it can cause heart attack, vasoconstriction, heart attack, or abnormal cardiac arrhythmias. Not a good thing to have. This is an example of a letter sent to a patient's home after they tested it, okay, for DCM. Your home's result were 560, California EPA was 400. This is another one that came out of the Layton study that I found. This home, residential, on that date had a level of 860. So, as a treating physician, I really kind of wonder if there was disclosure. It's all about disclosure to people, letting them know. And I don't know. Now, this is very important. How did I get here? You just saw the history. So we tested all of your hair, and we came up with uranium, and we came up with lithium, and I was pulling my hair out. I could have done some samples on it. Trying to figure out where this stuff came from. I'm on the phone. People thought I was a whack job, I'm sure. It's like talking to people in Seattle, talking to people back in the Midwest, trying to go through what's with the lithium. Okay? Now this led me to the point and say, Jeff, look at the water. You should look at the water. I was like, okay, let's look at the water. So the team of help, which I'm very thankful to, we implemented starting to test water. And we did it at the 11th hour. But we got lucky in the sense, and we got 32 samples back. This justifies me how I got here, because people were going, why did you test the water? Because I didn't know where the lithium was coming from. So I went to a local lab this time because of time. So we went over here to the City of Industry, licensed lab, and tested for these two things in water. Now, important to say, uranium levels 1.3 to 20. And if you look at the PCI, that stands for picocurie per liter of water. It's a measurement of radiation. Okay? EPA's maximum is 30. Lithium, 10 is what they call a minimal reporting level, or better defined as what the lab feels comfortable with when it's above that to say it's that. Okay? 10. There is no upper limits of normal on lithium. The EPA has not set one. Why? Because they don't test for it. Here's what we found. Uranium, let's just go to the bottom, which is easy. The average and the median was 1.77, well below the limits, okay? But it is detectable, okay? We looked at 6 districts that were not LADWP, okay? These are the areas, so you can read them yourself. Very small, correct? So I'm going, okay, well, probably not where the uranium is coming from. But then we looked at lithium. Average, 65.4. Median, 65. Controls, in 6 different water districts. Non-LADWP. Not the same water districts. All non-detectable, below the 10. I hope I can do this. They worked this out. So this is a map of what we did, and I think I just need to click. Correct, Craig?
Yes.
We blew this up and we put the levels on it. And we went down here in LA, have the same. We went over, non-detectable. That's South Pasadena. This is Santa Clarita. This is Simi Valley, Camarillo and Oak Park and Westlake. Hey, I did it. So I'm sitting there one day and I always get phone messages every morning. Latest articles, latest articles, latest articles. So I scroll through them and, you know, obviously it doesn't pertain to, you can't read them all. And all of a sudden, boop, pops up this article. New Science, lithium tap water. I went, what? Denmark study, August 2017. We'll focus on this. They tested water samples from 151 water networks in Denmark. Measured lithium levels for drinking water, 733,000 healthy patients, 74,000 people with dementia. What I want to point out to you is that high exposure, according to their article, is 15 and plus. Your average was 65.4. Summary by James Pickett, the Alzheimer's Society charity. In high doses or even low doses, in some people, lithium can be toxic. So it's important that people consult with their doctor because it is a prescription medication, okay? They mine for lithium, bring it up, put it in pills called lithium carbonate, and for those people who have manic depressive syndromes or bipolar affective disorders, they give them the chemical under the supervision of a physician, okay? So it's important that people consult with their doctor before they consider taking it as a supplement. I'd never take it as a supplement, I apologize. Even though if it is good for a hangover. So conclusion, thank heavens, right? SS-25 gas blowout exposed the community to toxins of unprecedented quantity, duration, and combination. Many people became ill and continue to suffer today. We'd all agree with that. Toxicology reports give a statistically significant difference in regards to the level of styrene, ethylbenzene, uranium, and lithium. It was demonstrated in the urine and the hair samples of the tested residents when compared to the rest of California as well as the United States. Positive toxicology with hair samples at various levels supports long-term exposure. In 26 homes, lithium was detected in LADWP. Conversely, non-LADWP water reported non-detectable levels of lithium. Very important. We do not know the source or the duration of the presence of the lithium in the LADWP water. I have no idea. Do not know where it came from. Don't want to speculate. We just found this 2 days ago. We clearly do not know the health impacts of the lithium at this time, and obviously it needs further investigation. There's abundance of information to strongly support the need for a comprehensive, independent, long-term health study from the toxins exposure from SS-25. Have we not been saying that since like day one? Yes. I'll say it again. My opinion, otherwise it's scientifically irresponsible to ignore the facts and allow the continued operation of Aliso Canyon gas storage facility. Do you want to do questions now or later? Oh, good.
Dr. Jeffrey Nordella. He hates this, but thank you's not quite enough, so thank you. What he just did here is astounding to me, that one man pulls together what should have been done from day one. We should have been very closely watched by those agencies that are here to protect us. It's amazing to me that one man took it upon himself, partnered with several people in the community, and pulled this together.